just to introduce our speakers. I'm John Gregor, and I'm the education lead for the charity, and I'm going to be in the background manning the chat. But giving this afternoon's presentation are Dawn Stillwell and Justine Duffy and Eve Paler, who are all work in our specialist advisory services, specialist advisors covering different parts of the country. And this afternoon's webinar is as you would expect, looking at taking a very wide look at things to do with continence. Obviously, thinking in particularly in things that might help if you're maybe in a family where there's with Huntington's and it's not a subject you're maybe too familiar with. So I'm going to hand over to Dawn. I think is going to start us off.
Thanks, John. Hello, everyone. Okay, so today the aim of the webinar is for us to look look and think about what problems with continence may occur, both with bladder and bowel, and look at things that might help for you. So everybody with continence and particularly with HD, everybody's situation is different, and therefore it's really important that if you do have any concerns, to look and seek professional support and guidance for your particular situation. So it's always important to rule everything sort of in or out. So please do keep that in mind as we go through today. Thanks, John. Okay, so incontinence in Huntington's disease, so it can more often than not occur later in the disease, and it may be caused by a lack of nerve communication. So people with Huntington's will have degeneration in a part of the brain called the striatum, which is involved in controlling urination and then can cause incontinence. However, so some common assumptions are it can be wrongly assumed that when there's an episode of incontinence that it's due to Huntington's, but there may well be other causes which can be treated, such as other illnesses and or infections. So again, it's something very much worth keeping in mind. And sometimes, due to the diagnosis of Huntington's disease, it's often not fully looked into or treated effectively. So, it's that seeking the professional advice and making sure the right professionals are involved in looking out for your person with HD, and that everything is being looked at. Okay, so some other things to think about as well. The NHS website is a very good place to have a look at lists of things that are possibly contributing to continence problems. And sometimes that can be that you're drinking too much alcohol or caffeine intake, which will sort of irritate the bladder and sometimes the bowel and make things move quicker. In other cases, not drinking enough fluids, which can cause strong concentrated urine to collect within your bladder and can irritate it and cause symptoms of over activity. Constipation is quite a common issue, and is always worth considering, why that's happening and what can be done to support that. And other medical conditions can be going on around that and causing issues. So again, it's that linking with the right professionals. Thanks, John. Okay, so is it functional? Is it a functional problem? So sometimes there's something in the process of going to the toilet that's not going right and causing the person to have problems maintaining continence. And the question to ask on that is there any support that can be looked at, routine sort of tweaks to routines or equipment that might improve the situation? Okay, so what aspects of Huntington's might impact, what aspects of the disease might impact on continence? So commonly we'll see balance and gait issues. So it's looking at that and thinking, how they're moving around, how quickly are they getting to the toilet, and managing to stand and with dexterity, get things like pants and trousers up and down, skirts, etc. So, how well are the hands working in order to do these things? Sometimes opening toilet doors, and particularly if you're out, if they're heavier than the doors you may have at home. The involuntary movement, so along with balance and gait, you're going to have people where they're not steady on their feet, and it will take longer to get to the toilet and perform them activities into getting onto the loo. Planning and organising, so um, it is often difficult around the cognitive problems we see with Huntington. So, uh, for people to actually acknowledge they need the loo, sometimes it takes longer for the messages to get there to the brain for them to understand and think, right, I need the loo, and then with the balance and gait issues, getting to and from, and apathy. So even if you're acknowledging your brain is acknowledging you need the toilet, is actually having the motivation and the energy to be able to get up and perform that action. So always keep apathy in mind as well. Insight. So we'll often talk about lack of insight into someone's condition, and actually, are they acknowledging that as a problem and doing something about it again? Medication can be a factor. Sometimes it can help. So they may be on medication for the movement, but sometimes it can have an impact on toileting. So it's thinking about the medication and looking at that, particularly if you've had a change. And behavioural factors. So again, with some people, we'll see sort of changes in behaviour, and is that impacting on your person's Huntington and their ability to get to the toilet, perform the action, understand that's where the loo is anymore, and things like that. So um, all aspects of Huntington's which might have an impact. Okay, so if balance and gait is causing problems or getting to the toilet, some sort of ideas of what you may be able to do is speak to an occupational therapist. They will sort of do assessments around movement, both in and out of the home, but look at what equipment that could be provided to help you with managing toileting issues. So always consider an occupational therapist referral. Looking at having extra rails in the toilet to get on and off, or to stabilize themselves when they're on the toilet. Raised toilet seats and sort of nice stable toilet seats, because sometimes they can be moved with people landing heavily and things like that. Toilet frames that can be fixed to the floor, so if there is involuntary movement, it's not going to get knocked around, it will stay stable for them. Is the commode going to be useful, or a bottle, and particularly when you're out? But sometimes in the home, the bottle is still well worth considering. If someone's thinking about sort of getting to the loo and how they're going to get there, is looking at how a room is laid out. How can they move around quicker, and will they need furniture to maybe stabilize themselves and things like that? But so they can navigate themselves from one room to another. That can be a good thing to look at as well. And a physiotherapist can advise on exercises or equipment that might help with mobility, which in turn can help with obviously all aspects of life, but again, in considering getting to and from on and off the toilet and things like that. So again, an OT physio referral together may well be useful. Thank you.
This slide.
Over to Eve.
Thank you. So as the slide says, we're going to look about involuntary movements. So movements can cause people a lot of problems, especially when accessing the bathroom. Having difficulties with spatial awareness is very common for people with Huntington's, and particularly in a small space like a bathroom, it becomes a bit more difficult. A lot of people have some problems managing their controlled movements, so actually lowering yourself on and off the toilet. When you've got movements that are impulsive, then actually trying to steady yourself can be very difficult. And for a large number of people who have Huntington's, they kind of just launch themselves at the seat or the toilet. So it's just being mindful that for somebody with those sort of difficulties, that accessing the bathroom can be a challenge and difficult, but they might injure themselves or they might damage toilet seats. I've met lots of family members who've gone through many toilet seats. So it's sometimes helpful having an OT involved, as Dawn's already mentioned. Just having a frame over the toilet might just be able to steady the person's movements and just slow them down a bit, and then that would just reduce the risks of injury to themselves and sort of breaking things. So it's also very useful to ensure that the right professionals are involved, as we've already touched on. Next slide, John. So dexterity is the next slide. So, and again, Dawn's briefly touched on this. Getting clothes on and off, those fine motor skills and having the dexterity to do those things changes as people progress with their Huntington's. So we always suggest clothes are easy to be able to get on and off, just so that actually getting to the bathroom and getting themselves prepared to use the toilet, it reduces the risks of accidents. For some family members, being able to keep clean can be difficult. And again, as we've already touched on, OTs can suggest there's a Closet toilet, I believe, I've not seen one, that can help people with their personal care and their hygiene, and then that reduces the amount of intervention needed from another person. If somebody can be independent in that area, then it's a lot more of a positive experience for that person. Planning and organising, and again, we've already touched on this. It's something we all take for granted when we're out and about, and particularly when we do our job and we're visiting people, we're able to think about when our next convenient stop is or where the next convenient bathroom is. And we do this throughout the day. We all do it, and we can assess ourselves if we can wait to get to a bathroom or not. And we make those judgments frequently throughout the day. Obviously, for somebody with Huntington's, that's more challenging. So when a person is asking to use the loo, then it's usually with a sense of urgency. They haven't got that planning that you and I have got. So it's ensuring that once a person says they need to go into the bathroom, that it's accessible, they know where it is. So there are a few tips here that might help with family members. Is having a good routine. We all know people with Huntington's love having a bit of structure, particularly around personal care and accessing the bathroom. It's just ensuring that the routine before we eat or when we go to bed or when we get out of bed is we visit the bathroom, and then that routine becomes normal. So there are regular visits to the bathroom for people to use the toilet. Now, if somebody's somewhere where they're in a different environment, it's knowing where the bathroom is, and we've all done this. We'll go into a place and we'll clock where the loos are. It's just verbalizing that information. So if you are in a new place or you're visiting family, it's just ensuring that information has been shared. This is where the bathroom is, so let me know if you need a hand with anything. Along with the routine, lots of prompts, if we're going out, if we're going in the car, shall we pop to the bathroom, got your coat and shoes. Just those little friendly reminders can really make a difference, and really help people just maintain their independence and just be a bit more consistent. And also thinking about language, I say bathroom a lot because that seems very polite and dignified. Actually, a bathroom is a bath. We need to use the word like toilet or loo, words that indicate what we're wanting that person to do. So just being mindful of your language and the words you're using. So some people with Huntington's might be less inclined to go to new places or just leave their familiar surroundings. Again, we know that people with Huntington's like predictability. When you're at home or when you're in very familiar environments, you know where everything is, and that makes us all feel safe. So for some people, it may be there's some anxiety about actually going out, and it might be reassuring for them to have a conversation about, we're going to go here, and we're going to go and visit family, and we can go to the bathroom before we leave, and all those sorts of things. So sometimes just a conversation might be enough for the person you're supporting, and it may be that you can do other things that will just reassure them a little bit. Packing a change of clothes. If there is an accident, then we can sort that out. And again, Dawn's sort of touched on this a bit earlier on, and having having urine bottles and those sorts of things, it's just peace of mind. If I get caught short, can we solve that problem? And sometimes that reassurance really helps people. And as Dawn's already touched on a little bit earlier, apathy plays a big part in sort of motivating people. It's not that people can't do the activity, it's just thinking it through and actually having the energy to follow it through and do the whole task. It sometimes feels too big. So again, going back to routine and prompts, it really helps people and just maintains their independence and their dignity like we want to. Insight. So, as we all know, some people with Huntington's may not have insight into keeping themselves clean or their environment and those sorts of things. So it can be really upsetting, not just for the person themselves, but obviously for those that are supporting them. So keeping clean is not something the individual may notice, and it can be quite hostile to having physical support from somebody else. So it's sometimes a more subtle approach is helpful, just gentle prompts, having a nice bubble bath ready for people to just get into, rather than sort of saying, do you want a bath? The bath is ready, let's get clean. Putting clean clothes out might help someone to just again prompt them to change their clothes and just keep clean. And another thought maybe is having the discreet incontinence pads. If that's what's in the drawer, then that person is going to reach out for that and put those on. So just little things might make a difference, but the important thing is to just keep trying. There are different sort of thoughts and processes that we can suggest to help people maintain their dignity and their hygiene, and it's just keep prompting and keep trying, because hopefully they'll pick up on those cues.
So just having a think about medication. So we've just popped here that some medications, for example, some antidepressants, so some of the SSRIs that are commonly used, they can be associated with an increased risk of urinary incontinence. So it's just keeping an eye out for that. If you do think there's a link, you've started a new medication, and that's when the incontinence symptoms have presented, definitely speak to your GP about that. We've popped that in bold. It's really important that you don't stop any medication cold turkey and that you always consult a health or medical professional first. They might say, yeah, it's a really common side effect of what you're taking, we'll swap you over to something else. Or they might say, actually, that's not a listed side effect at all of what you're taking, so we need to be exploring this further and looking for other causes. And then there are medications that can help as well, depending on the problem. So again, please speak to your GP. There's various medications that help with an overactive bladder. Of course, if it's an anxiety-related problem, we can look at medication for that. And if it's something like an infection, of course, we'd probably be looking at antibiotics. So it very much depends on the situation, but sometimes medication is the thing that we need to be looking at. Thank you, John. So perseveration. So sometimes people with Huntington's can get stuck on certain ideas and can find it quite difficult to move on from an idea. We tend to call this perseveration. It can present in slightly different ways. So it can become apparent if somebody with Huntington's starts becoming obsessed with a particular item and starts buying that item to excess. Other people with HD might have compulsions that take the form of repetitive behaviour and repetitive actions, which might be associated with the obsessive thought. People can become obsessed with intrusive thoughts, and this can lead them to suffer with anxiety. So sometimes this is linked to the bladder or the bowels, and we find that people are getting quite worked up about it, and they're perhaps trying to go to the toilet every 10 minutes, 20 minutes, 30 minutes. So we've just said on here, sometimes people can become very focused on the idea of going to the toilet and keep coming back to this again and again. This can be really frustrating for both them and the family or the people that are looking after them. So just a couple of things to try. Reassurance that all possible steps will be taken to ensure that the person can get to the toilet when they actually need to get to the toilet. So sourcing the toilets when you're going out in public, knowing where they are, maybe having those emergency kits and things with you that were mentioned earlier. Distraction onto another topic or activity that the person with Huntington's is interested in. So sometimes something as simple as a positive distraction can just help relieve some of those obsessive thoughts and anxieties. And then again, medication can be considered. So if it is stemming more from an obsession that turns into then quite a worry and a large anxiety, we can perhaps look at medication for that to reduce those anxieties. Thanks, John. So sometimes incidents of incontinence can actually be a way of communicating another need. So we're just exploring here, could it actually be a behavioural issue? So if someone's scared, lonely, or perhaps they're quite isolated, they might notice that when they have an episode of incontinence, that they grab people's attention and time because people have to spend time cleaning them up, getting them a change of clothes, getting them a bath, looking after them. So sometimes looking at ways of addressing the underlying problem, for example, if that's isolation, could actually be a way of addressing the continence issues as well. So this is a good place to mention sort of like behaviour diaries and things. So it's quite a good idea to try and start logging things. So is there a pattern? How was the person's mood before, during the intervention and after? Is it happening on certain days? Is it happening around certain staff members? Are they trying to catch the attention of a favourite staff member, for example, if they're living in full-time care? So doing a behaviour diary can sometimes pull out if there's any pattern there, and then we can pick it apart a little bit further. So we've just popped here some of the equipment which might be helpful. I think Dawn and Eve have mentioned some of them already throughout, but we'll just hop through them quickly. So washable bed pads that tuck into the side of the bed. They help to absorb the urine, which in turn protects the skin and the mattress. So Kylie's are a common one that a lot of people have heard of. So it is spelled Kylie, like Kylie Minogue, but there's lots of different brands that you can find available on the internet. There are also disposable ones as well. So they do the one-time use options that you chuck in the bin, but they also do the washable ones as well. Waterproof duvets, waterproof mattress toppers and mattress protectors. These can be brilliant because they can just be sort of wiped down and washed. However, they are a bit of a sort of dodgy, different texture, so they're not always ideal for everyone. They can be a bit noisy because they're a slightly different texture, so it's just seeing if that works for the person, really. Absorbent mats for chairs, so things like armchairs. We've just popped here though that we might need to perhaps involve the RT with this. So if somebody has involuntary movements particularly, we want to check that it's not going to cause them to wriggle and slide out of the chair. So whilst they're brilliant, we also need to check that they're safe. So just check that for suitability before sort of marching ahead and using one of those. Urine bottles have been mentioned a few times. I'd say particularly more for men. They're easier to use, although anybody can use one. It's just a bit easier for men to aim. I have a few chaps that use these, particularly at night time. So if they've got stairs in the house, but it's a little bit more difficult to navigate the stairs at night, it might be dark. They might not be fully alert if they wake up in the middle of the night. So it might be that they can use the stairs safely in the day, but actually in the night they don't feel so safe to use the stairs. So having a urine bottle next to the bed can just mean that they can empty the bladder during the night without having that risk. So they're just reducing the risk a little bit there. That said, you can use them anytime, but I do have a few people that just like to use them in the night. Or when you're out and about, they act as a bit of an emergency aid in the car if perhaps there's no access to a toilet for a significant amount of time, or if the urgency's there. And even if there's a toilet 100 metres away, you're just not going to get there. And then bedpans as well. They're also useful. Thanks, John. So some other products, so incontinence pads. So again, there's so many different brands and variations available from, pull-ups to more discreet ones. What works for the individual highly depends on the amount of liquid that they're producing, that the pad needs to absorb, and also how they present. So if they've got quite a lot of extra movements, it might be hard for them to keep a pad in place. If they're struggling with dexterity and they have nobody to help them, it might be hard for them to get the pad on and off. and put it on securely. We have just said here as well, although they are available in most supermarkets and also sort of drugstores like Boots and things, we would always generally do a referral to the continence team and see if the person was able to qualify for pads on the NHS. And then they're not having to pay for them. But in the meantime, or if someone didn't qualify for some reason, there are availabilities in lots of the larger stores. Washable continence underwear is available as well. So this is probably not a new thing, but a little bit newer. So you've got your sort of it's like inbuilt into your underwear, so it looks more like you're wearing a proper set of knickers, for example, and the pads sort of built into that. Some people prefer those; they feel a little bit more dignified, feels a bit more sort of normal, although we shouldn't really use the word normal. So they're available as well and can sometimes be more popular. Other people prefer just the disposable and just keep throwing them away. Sheaths for men might be considered as an alternative as well. So we've just said to consult your doctor. So just in case anybody doesn't know, a sheath is a device for men to manage incontinence. It's a bit like a silicone condom, which you place over the penis and secure with a fixing system, usually an adhesive one. And then the urine flows into a bag, which is usually attached to the leg. And they're usually quite easy to use. I've got, again, some chaps that just use them overnight, not necessarily all day. They just use that to manage in the night so that they're not worried about leaking and they can have a better night's sleep. Some of the benefits reported are that they're considered more comfortable than a normal catheter, that the risk of infection is a bit lower than using a normal catheter, and also that they're quite discreet and quite easy to use. We've just popped there as well, according to the NHS website, urinary catheters might be offered as a last treatment for incontinence. Again, often people try the other options first, particularly because catheters are a bit more invasive, and also there's a risk of infection there as well. And then skincare and hygiene products to help protect skin. So we're thinking things like barrier cream, and also washing every time there's been an incident or someone's passed a movement if they're not, they're not using the toilet and they're sitting with a product on. And then just some options for sort of further information, some sources that might be useful for you. So we've got some occupational therapy sort of guidelines on our website, and it would fit under the self-care section. The Bladder and Bowel Foundation are brilliant and the website's there. And then the continenceproductadvisor.org website is also really useful. Lots of good information on there.
Thanks very much. And I think that kind of brings us to the end of the presentation. Thank you to Dawn and Justine and Eve for hosting the webinar. Thank you for coming.